Hello, and welcome to the COVID-19 Emergency Temporary Standard, or ETS, overview for veteran employers. This training is provided by Bay Aging for veterans enrolled in the Veteran Directed Care, or VDC, program. In the face of the devastating impact of COVID-19 pandemic, the Virginia Safety and Health Codes Board has adopted an emergency temporary standard to protect employees and employers from the spread of COVID-19. This is for the safety of you and your employees. As an employer in the state of Virginia, you are required to comply to the emergency temporary standard, which is in effect immediately. To help you achieve this compliance, I will walk you through the 9 steps outlined in the Guidance for Employers and Employees handout in your packet. Step 1. Assess your workplace for hazards and job tasks that could potentially expose employees to COVID-19. To aid you with this process, use the Hazard Assessment Worksheet provided in your packet. Generally, our employees will be medium risk because they live or access the home on an ongoing basis. However, if you believe they are at high risk or very high risk, you will need to also develop an infectious disease prevention plan. Step 2. Establish and implement a process for employees to self-assess and screen themselves before reporting to work. Employees should complete temperature checks daily and monitor for signs or symptoms of illness. You should not allow an employee who has symptoms of the virus to report to work. Step 3. Provide flexible sick leave policies and encourage employees to immediately report any symptoms of the virus to you. If you have multiple employees, consider implementing staggered shifts to reduce or eliminate contact with other employees. Step 4. Establish and implement procedures that will prevent sick employees and other persons from infecting healthy employees. Employees should be socially distancing from each other, 6 feet or more, wearing appropriate protective equipment such as masks, gloves, and/or face shields, regularly washing their hands or using hand sanitizer, and sanitizing any touched surfaces such as pens, door handles, kitchen areas, bathroom areas, or any other area of the house. Step 5. As mentioned in Step 2, employees who report symptoms should not report to work. As an employer, it is your duty to establish and implement a procedure that not only prevents infected employees from reporting to work, but also establishes procedures for them to return to work safely if they are suspected or have tested positive for the virus. You should prohibit employees from returning to work until they have been cleared through a symptom-based or test-based strategy. If you have questions or concerns, please consult a healthcare provider to ensure it is safe for the employee to return to work. Step 6. Establish and implement a system for notifying employees of workplace exposure to the virus and suspected or confirmed cases of the virus. This means if you or another employee becomes infected with COVID-19 or suspect you have been exposed, you will need to notify your employee or employees immediately so they can take personal actions to protect their health and safety. This could be accomplished with a phone call or a text message. Step 7. The anti-discrimination provisions of the standard indicate that no employee shall be discharged or fired or in any way discriminated against for the following 3 reasons. They have exercised their rights under the safety and health provisions of Standard 90 of Title 40.1 of the Code of Virginia. They have voluntarily provided and wear their own protective equipment, such as masks, gloves, face shields, or other devices, as long as it does not create great hazard to you, the employee, or other employees. Or if they have raised reasonable concern about infection control related to COVID-19 virus, to the employer, other employees, a government agency, or the public through any media outlet. Step 8. This step is only applicable if you have determined an employee is at high or very high risk. If you have, you must prepare an infectious disease preparedness and response plan and train employees on the practices within 60 days of the effective date. Please contact Bay Aging if you need a template of this plan. Step 9. You will need to provide COVID-19 training to all medium, high, and very high-risk employees by August 27th. The training should include requirements of the ETS standards, characteristics and methods of how the virus spreads, risk factors, awareness of transmission, and safety and health work practices. Training materials were provided in your packet from Bay Aging, and more can be found on the Virginia Department of Labor and Industry website. If you have any questions on these temporary standards, please contact Jennifer Rose at 804-786-7776 or visit www.doli.virginia.gov.